Hi, folks. We are here on what day is it? Wednesday. We're here on a Wednesday in the afternoon / evening, depending on where you are. And we're going to talk about the monkey situation. And that's why we're here doing this impromptu stream today, because somebody messaged me saying, "Hey, did you hear about the situation with the monkeys in Mississippi?" So if you haven't heard about it yet, there was a truck going on I-59 carrying 21 rhesus monkeys that are used for animal experimentation for biomedical research. And this truck crashed, and the monkeys, at least 6 of the monkeys, escaped. And there's concerns that these monkeys may be carrying herpes, hepatitis, and COVID. And that's specifically what was communicated. So this has become a huge public health scare in the community. News update. Yes. Yeah, that is what is happening right now. So this is going to be a bit more casual of a stream just because we're still learning more information as it comes out. But there have been some updates since yesterday, and this is a whole shit show, and it does call into question some really important points, especially regarding, animal experimentation and transport of said animals. There is for sure an issue regarding legal versus illegal transport of these animals, and there is a big trade, like illegal trade of primates into different countries, because of course you can make a profit off of that, and the populations are pretty easy to maintain of rhesus monkeys. But we have to remember that there's a distinction in these different practices. The ones used for experimentation are obtained legally and have to be registered. Like, you have to have a license to keep these animals, etc. And there are a lot more precautions that go into having research animals that we need to take into account. But I have multiple different sources kind of telling the same story slightly differently. We'll see a video from the initial report, and then we will see the updates. PETA also released a statement. Tulane University released a statement, and we'll also probably talk a bit about the specific diseases that are in question, what the risks are to the community, what I hypothesize could potentially happen if the one monkey that's still out there kind of gets away. So that's the plan for today. Feel free to put comments, questions in the side chat. This should be an interesting show. I also have I have a 4-pack of the immunity shots, so if we get some super chats today, I will do these. Also, the dog is very angry that he's outside right now. But let's get into this. So here's the initial video, or at least maybe, I don't know if it's the one of the initial ones, but this is from not today. This is from yesterday, I believe.
Tonight, the urgent search for dangerous research monkeys that escaped from the wreckage of a crash on a Mississippi highway.
We got 21 monkeys that was on this, got 5 of them on the run.
Video showing several monkeys crawling in the grass. Heavily armed officers responding to the scene. Authorities say a truck carrying nearly 24 rhesus monkeys from Tulane University overturned on Interstate 59 in Jasper County.
Here's one of the monkeys right here. There's one sitting right there.
So you can see the monkey just sitting in
6 monkeys
the
escaping.
truck.
Officials warning they might be aggressive towards people and were potentially infected with hepatitis C, herpes, and COVID.
They may have to neutralize something out here in a minute.
And late today, police confirming all but one of the escaped monkeys had been euthanized for public safety reasons, adding they're still actively searching for that one monkey still on the loose. Well, the monkeys that did not escape from the truck are said to be okay and accounted for. Mola Lengi, ABC News, Washington.
All right. So that's kind of what the situation was initially, and it was really funny just getting that message. Like, what timeline are we in where we're worrying about uh, hepatitis and herpes and COVID-ridden monkeys escaping onto a very busy interstate? But here we are. This is the timeline. However, this is not everything is not as it seems. The media does get things incorrect a lot of the time, and especially we know that law enforcement can exaggerate their claims and exaggerate the situation because they are not trained in science or medicine, and they don't always interpret the situation correctly. So let's get into this a little bit, shall we? So I am going to pull up the updated article. Here we go. So this one is from today, and it has some videos with this as well. The number of escaped monkeys still missing rises to 3 after Jasper County truck crash. So this was updated this afternoon. So they had 3 missing. There's some sources that are saying that only 1 is missing now. Maybe they realize that there are 3 missing. I don't know the exact number of the monkeys that are missing. It's some number between 1 and 3. So this update from 1:49 p.m. Central Time today says, in Jasper County, Mississippi, authorities say that 3 monkeys remain on the loose after a truck transporting research animals from the Tulane National Biomedical Research Center overturned Tuesday afternoon on Interstate 59 north of Heidelberg. The Jasper County Sheriff's Department confirmed Tuesday evening that the number of missing monkeys increased from 1 to 3. So they are claiming there are now 3 monkeys missing. After Tulane officials were able to safely access the wrecked truck and conduct an updated count. Tulane staff arrived at the scene earlier than originally expected and are searching the area for the missing animals. The crash led to the escape of 6 of the 21 monkeys on board. 3 have since been recovered, while the remaining 3 are still unaccounted for. The driver of the truck told law enforcement that the monkeys were dangerous and posed a threat to humans, the sheriff's office said. We took the appropriate actions after being given that information from the person transporting the monkeys. He also stated that you had to wear PPE equipment to handle the monkeys. So this is an important piece of information right here, is that the monkeys, so the report that the monkeys were diseased was from the driver of the truck and not from the place that was distributing the monkeys. And we'll get into kind of Tulane's statement, but Tulane essentially said that they did not own the monkeys. The monkeys did not come from them. They belong to another institution. So it's kind of unclear at this point. Did the monkeys come from Tulane University but belong to some other group, or are they saying that they had no relation to Tulane University? It seems to be communicated that it's the latter, that there's no connection with Tulane University's primate lab, which they do have a primate lab. But there are other research institutions that do primate research in that area in the country. So it is possible that Tulane is being accurate and not actually responsible for these monkeys. But Tulane also said that see if I have Tulane's here. I have another article here. Let's share this one. Here, this article is a bit more hyperbolic, let's say. Truck full of aggressive research monkeys crashes, setting primates on the loose. So the Jasper County, Mississippi Sheriff's Office said the incident occurred on Tuesday when a truck carrying rhesus monkeys from Tulane University crashed. So the Sheriff's Office claimed that it came from Tulane University. That the monkeys are approximately 40 pounds and they are aggressive to humans and require PPE to handle. The Sheriff's Office said in the statement posted to Facebook, the monkeys carry hepatitis C, herpes, and COVID. That is what the Sheriff's Office said. And at that time, they were thinking that it was just one of the escaped monkeys that was still out there and that the other ones were destroyed or were euthanized. But since then, it seems that there are actually 3 still on the loose, and we don't have additional updates since then. Mississippi Wildlife and Fisheries, along with law enforcement, responded to the scene, and an animal disposal company was contacted to assist. A spokesperson for Tulane University said the school was not consulted regarding the destruction of the monkeys. They also released the following statement. So the monkeys were supposedly belonging to Tulane University, and before destroying the monkeys, they didn't contact the institution for more information. They just went off of what the truck driver was saying about it. So just going off of hearsay, essentially, from the truck driver, who may or may not have been given accurate information, or may or may not have considered the information he was given, might not have understood the information, even if the truck was coming from Tulane University. Non-human primates at the Tulane National Biomedical Research Center are provided to other research organizations to advance scientific discovery. The primates in question belong to another entity, and they have not been exposed to any infectious agent. Okay, so we have some clarification now that these the monkeys came from Tulane, but they were going to another institution. So Tulane was providing the monkeys to the other institution. So here's the kind of the process that we're at. So we're not necessarily talking about illegal monkey trade here. We're talking about most likely monkeys that were raised at the institution and transported to this other or at least we're on the way to being transported to this other entity that had purchased the animals for research purposes. So likely these were not part of an experiment yet. If you're getting animals for an experiment, odds are you're going to conduct that experiment on your own. Like, that company that is receiving the monkeys was going to be the one to conduct the experiment. So you don't have monkeys that are perpetually diseased per se. Like, sure, you could be doing a study looking at vertical transmission, which just means transmission from parent to offspring. It's possible to have a study related to that. However, that doesn't seem to be the case for this. So they were just sending the monkeys out to somewhere else. So most likely they were not already infected with anything, and they were just being sent out. So that piece of information is not true. But either way, Tulane sent a team out there, a team of wildlife experts, to go help manage the situation and contain the escaped monkeys. So let's talk a bit about transmission of diseases amongst monkeys, between monkeys and humans. So we're talking specifically about the rhesus monkey, which is known as an old world monkey. They're found on the other side of the world, usually not in the Americas. And there are definitely environmental and public health concerns related to zoonotic transmission of disease. And so this is from the Virginia Department of Health. So I have a couple articles like this kind of going into depth on this. So just kind of discloses that due to the close genetic relationship between non-human primates and humans, of course, you can pretty easily have diseases that transmit between them. And these can be bacteria, fungi, parasites, viruses, etc. A lot of these illnesses can be transmitted through bites, scratches, handling the animals, and sometimes you don't really notice any evidence that there's been a disease transmitted until someone becomes symptomatic, or if one of them carries the disease to somebody else. The thing, though, that is particularly being mentioned by this article is not necessarily people just coming into contact with random monkeys. This is related to humans that are actively working in laboratories with these monkeys and have significant exposure. So keep in mind that a lot of these diseases, they have certain methods of transmission that are necessary in order to get somebody infected. So you can have diseases that transmit through air and through droplets, which kind of COVID falls into more of droplet transmission. And that can be pretty significant, especially if you're talking about being in the room with somebody else with an illness. COVID definitely is transmitted in more of that way. It is less likely to be transmitted through contact outside. Sure, if you're in super close contact, yes. But if the virus has places to go outside of a room, it's going to be a lot harder to get the number of viral particles in order to come down with the disease. So even then, having these outdoors, as long as people aren't getting too close in proximity, shouldn't be as high of a risk as being in contact with a human that has COVID, or being inside with COVID monkeys. Some of the other diseases we'll get into in a minute, but these diseases typically affect people that are working in close contact with them as importers, and also with those working in these research centers. So of course they mentioned rabies. That's a very important point. Interesting that rabies was not mentioned as one of these public health concerns. They specifically mentioned herpes, COVID, and hepatitis C, which is an interesting the hepatitis to mention, just knowing the transmission of that virus. But probably the couple of the biggest concerns here is this B virus. And looking at this, so up to 90% of adult macaques can be carriers of B virus, and most are asymptomatic. But some of them can have oral lesions, so like cold sores, similarly to in humans with herpes simplex 1. But this one, since it is often asymptomatic, this is where people need to take extra precautions, and especially where that PPE was mentioned. So when we are wearing PPE, it's not always because there's a known infection in the area or in the specific organism. It may be because there's risk. There's a risk that you just don't know what these animals may be carrying. And if you have high suspicion, then it's worth it to wear PPE. It's very low risk to wear PPE when you don't need it, as opposed to not wearing PPE when as opposed to not wearing it when you do have that risk. So that's the reason. It's more preventative than it is for like absolute transmission reduction, right? So that's an important distinction, and that's a discussion that we get into as well with the fentanyl conversation. And I went into this in my fentanyl live stream a few years ago, where cops, of course, they're advised to wear gloves when they handle substances that they don't recognize or can't test while they're there, because sure, you have some compounds that are more readily absorbed through skin contact. You also either want to wear a mask or a respirator to prevent inhalation of some of those, because who knows if you're dealing with something corrosive versus like an illegal drug, like fentanyl in somebody's car, saying keeping that separate from prescription fentanyl. But cops wear gloves and protection when handling fentanyl, not because fentanyl is readily absorbed and actually a danger within skin contact. They wear it because it's an unidentified compound. They don't know what it is, and that is a precaution to, of course, prevent harm from happening to them. So that's an important thing, because as we saw in the from the sheriff report, is that they just believed that these animals had the diseases, number one, because the truck driver told them so, and two, because they were told they have to wear PPE when coming into contact with the monkeys. None of that confirms that the animals actually are infected with these things. There's a very difference in statement from saying, be careful, they could be carriers of these things, versus saying these animals are infected. It's a bit of a telephone game, and we need to be very careful about how we're communicating information, and that the other party knows what we're saying and understands the information that has been communicated. So, small thing, but that does matter, because this may not have been as big of a story. I mean, it still probably would have been. There are monkeys that escaped on the highway. That is a pretty unusual thing within the United States. If we were somewhere in East Asia, Southeast Asia, South Asia, this would not be as big of a conversation, because, monkeys run wild on those streets very consistently, because they are native to those places. But it's a bit rare here. So I'm sure it would have been a big story. Just the headlines would not have said that they were infected with Hep C, herpes, and COVID. But back to this B virus, presents very similarly to herpes simplex in humans, except for in non-human primates. And most of the 25 well-documented cases of human infection have occurred in laboratory animal handlers who are somehow directly inoculated with tissue or fluid from the monkey via bite, scratch, needle stick, or laboratory injury. So the concern here is that the monkeys are aggressive, and that could be very well be true, especially since these animals have come accustomed to being around humans, and these lab-based animals, I don't know the psychological state of an animal in this kind of experimental setting. I don't know how they're keeping these animals. I know they have veterinarians on staff and primate experts there to monitor them. So I would like to be able to trust them that they are accounting for the typical needs of these animals. And I can only imagine they would be doing their best to do that, seeing as you want to standardize as many variables as possible. If you're trying to study disease patterns, disease symptoms, disease presentations, that you're using that to translate to human medicine, if you're going to do that for monkeys, you need to make sure that you're not confounding the data with monkeys with depression from inadequate care, right? So that is something to consider. But of course, if we're talking B virus, there is some concern if you are in the area of these, if you get scratched, bitten, etc. Sure, this could be a public health risk of B virus. Kind of similar thing with tuberculosis. TB is a bit more easily transmitted between humans, and a lot of TB cases are transmitted from humans to monkeys. And then I guess if you have the monkeys in the right place at the right time, it could go back to humans through those monkeys. If we're talking about diseases that become problematic from just being in the general vicinity. Tuberculosis is probably the biggest concern kind of next to COVID, because COVID we have vaccines for, we have ability to prevent that a bit better. Tuberculosis, kind of the way we manage, well, the way we prevent this is by not having exposures, by trying to limit our exposures. If someone has TB, like they're going to be in a negative pressure room, they're not going to be around other people. Healthcare providers and healthcare workers have to have TB tests at least annually in most places to prevent transmission of TB. Most places that have high risk of tuberculosis outbreaks are prisons, military barracks, etc. Places where there are tightly cramped people that could have exposure. So, and also homeless shelters are another place that see high rates of tuberculosis. So if you're not around these monkeys, though, your risk of contracting TB are probably a lot higher just being in the vicinity of a prison. And when I say vicinity of a prison, like living in a prison, working in a prison, etc. Like your risk is higher there, or working in a hospital. Your risk is a lot higher in that case than being somewhat close to these monkeys. Just don't, if you run into a monkey on the highway, or if you run into a monkey just out in nature in Mississippi, don't run up to it. Don't try to pet it. Like get people involved who know how to handle that situation. That is probably an appropriate thing to report to the government and to public health. But if you're not right up next to the monkeys or not touching them, probably don't need to worry as much about B virus or even tuberculosis. Same thing with wound infections. It's the same kind of thing. Don't touch them. Enteric disease is usually transmitted through fecal oral routes. So that could really be an issue with water supplies. If you have monkeys pooping in the water supply and then you're drinking it and not purifying your water appropriately, not using treated water. Again, so things that are fairly preventable. Again, like, and don't go into a monkey exhibit, touch the monkeys, and then eat something without washing your hands. Like, yes, you should probably be wearing gloves when interacting with the monkeys. Talking about simian immunodeficiency virus similar to HIV. Please tell me you're not going to get this. This one, and looking at hepatitis C, it raises some flags about what do you think people are doing with these monkeys? What do you think the public is going to do? Because the routes for transmission of HIV, and in this case SIV, is sexual contact, and it's a bloodborne pathogen. So, and even you're not going to get HIV just by touching somebody's blood. The blood has to get into your body, and specifically into your bloodstream, in order to really have any chance of transmission. There's a huge stigma related to immunodeficiency viruses. The HIV positive population struggles a lot with human interaction, especially with healthcare providers, because people will put on like full hazmat suits sometimes to go talk to them. And that is not how these diseases transmit. If you are having sexual intercourse with somebody who is HIV positive and still detectable, that is a case where, yes, you do need to be cautious. But the way that you get HIV from sexual intercourse is from micro trauma, or at least the most common hypothesis is that it comes from micro traumas upon that sexual activity, and then the virus can get into the bloodstream that way. So you'd have to try very, very hard to get immunodeficiency viruses from humans, much less monkeys. I hope that people are not going to run into Mississippi and start having sex with the monkeys on the side of the road. However, this is Mississippi, and I can't just assume that people aren't going to try that. But please don't do that. That's not smart. And that could be the other way that you get hepatitis C from monkeys. Also looking at Ebola, we don't really see Ebola. I mean, it looks like there was an Ebola outbreak in Reston, Virginia, which is interesting. But Ebola's a lot easier to contain than some of these other illnesses because of the low transmission risk. It's a lot harder to get infected if you're not in direct contact with somebody with Ebola than it is with COVID or tuberculosis. And then they mention here, non-human primates are more likely to contract hepatitis A, measles, or polio from humans as part of a laboratory experiment than to transmit these diseases to humans. So more often than not, the diseases, especially in these laboratory animals, gets to the animals through humans and not often the other way around. I have another article here. Hey, Harder Gamer, welcome. I know we didn't have a whole lot of people show up at the beginning. I know this is a unusual time for me to be streaming, but we are talking about the monkey incident from yesterday. I was just about to pull up another article about old world monkeys and health concerns. So here we go. So this, again, gets into zoonoses associated with old world monkeys, aka macaques, which the rhesus monkey is a type of macaque. So their summary here, and this is from Princeton University. I tend to trust this university for what they're saying. So this is a safety information sheet specifically for faculty, students, and staff who conduct research with macaques. So again, we're talking about people in direct contact with the monkeys. And so if you're not working in a monkey lab or you're not in Mississippi trying to go wrestle these monkeys on the side of the road, you are probably okay. Just stay away from them and keep your distance. So the zoonotic agents of concern that they mentioned. So they mentioned herpes B, so that's B virus, like I was just talking about. And this is spread from macaques to humans through splashes of body fluid, such as saliva, conjunctival, genitourinary secretions to the eyes, nose, and mouth. Yeah, so don't be touching the eyes or genital regions of the macaque, and you should probably be okay. Bites and scratches, that's probably more common, especially if we're thinking of salivary transmission, and broken skin in contact with macaque body fluids or soiled equipment that have been in contact with macaques. So avoid their body fluids, and that's kind of the big thing to get away from this. But this is concerning, mentioning here that the transmission of the herpes B virus, which has a 70% mortality rate in humans if not treated immediately. So this is a public health concern. So for the people out there trying to subdue the monkeys, they need to be cautious of this and get treated immediately. Onset of disease can occur within 3 to 7 days and up to a month after exposure. So this is a case where they should be getting tested and getting appropriate care. But if you're not around the monkeys, don't worry about it too much. Prevention, yeah. So wear personal protective equipment, PPE, disposable lab coat, gloves, surgical mask, face shield or safety glasses, gown, booties, and bonnet are required when working in macaque housing and procedure areas or when handling soiled equipment from these areas. Long pants, hand washing, and disinfect your equipment. So there we go. We have some recommendations for prevention of these transmissible illnesses. Yeah, and clean your wounds if you get one from the monkeys. So if you're in Mississippi and you wrestle the monkey on the side of the highway, probably go to the hospital about it. That's a great idea. So other macaque zoonotic agents of concern are hepatitis A. So hepatitis A is specifically more of a concern. And the reason, of course, is that hepatitis A is transmitted via fecal oral routes more commonly, and not through sexual activity or bloodborne transmission, which is more commonly seen with hepatitis B and hepatitis C. So again, don't have sex with the monkeys. And that's probably something lost in transmission, even though, sure, is there possible risk of getting hepatitis C from monkeys? Yes, but don't do those things with monkeys. And if you're not one of those treating them at the research facility, then you probably don't need to worry about it as much. So, but hepatitis A, definitely more concerning. Pox viruses, RSV, especially if there are children in the vicinity. Rotavirus, also, again, if there are children in the vicinity. RSV and rotavirus can be very, very deadly to young babies, which is why there are vaccines now for these. Simian hemorrhagic fever virus, simian retrovirus D, T-cell leukemia, simian virus 40. I don't know exactly what that one is. Bacteria such as Campylobacter, which is a GI tract illness. So Campylobacter, Shigella, what else we have on that? Those are the big GI upset, like when we think of things like dysentery. So if we separate out GI illnesses, dysentery is usually bloody. So people don't often get dysentery anymore with food sanitation and hygiene practices. But Campylobacter is one of those that can lead to that. Shigella, especially. Shigella and E. coli are kind of the big two with regard to like causing dysentery and like bloody bowel movements. So those are particularly dangerous. Strep pneumo, we're thinking of pneumonia, especially like strep pneumo usually causes community acquired pneumonia. So something that is very commonly treatable and also very prevalent among human populations from the beginning. Mycobacterium TB. So yes, we already discussed some of the TB risk. Bordetella is one of those that is transmitted between animals and humans. I believe that one's more associated with cats, but I could be misremembering. But either way, that one's more with animal bites and animal scratches. And Haemophilus influenzae, or H. flu. H. flu is another one of those pneumonia-causing organisms. So we have a few respiratory bacteria and a few GI bacteria within that. And then parasites can be transmitted, strongyloides, and some other ones. So there are risks of like zoonotic transmission of disease, but not the one of them that they're correct about. Yes, herpes. When they say herpes, like people are thinking of genital herpes. Like when we all heard the story, I'm sure the thought was genital herpes. And that's not what we're talking about. We're talking about B virus, which is that kind of facial lesion, more like a cold sore thing in the monkey, but can cause severe illness in humans and is associated with 70% mortality rate in humans. So that is the herpes virus that we are talking about. Let's talk about hepatitis C, though, just because that was mentioned as an issue. So if you happen to get hepatitis C from a monkey, which kind of doubting is the real concern. I'm thinking that they meant to say hepatitis A. But this is, of course, hepatitis relates to the liver. The liver is important for a lot of specific functions, namely detox of the body, also producing bile for fat digestion. It's also, the liver is also very, very important for blood clotting production. So if somebody has bleeding disorders, it's possible that that is related to hepatitis or some kind of liver failure. And specifically, we're talking vitamin K and platelet production. So that's something, to think about with all this. But the liver does a lot of stuff. And so if you get a liver infection, it can be very serious. Luckily, hepatitis C is actually manageable. We do have medications to treat hepatitis C now. And the management of hep C kind of sounds very similar to management of HIV. Let me see if I can find like a good graphic for this. Yeah, there's a bunch of different regimens, but I can't find a super good graphic. But it used to be a lot harder to treat. But now we have options such as anti-inflammatory management, antiviral management. So we can treat hepatitis C. It can be very expensive, though. That is the one thing. So it's worth it to not get hep C and to try to prevent transmission as much as possible with that. But it is easier to manage hep C than some of the other hepatitis. I like to say that word hepatitis. But and hep C is often more of a chronic thing, unfortunately, too. It ends up kind of staying in the system for a long time, and that's how it kind of gets you. So, yeah, hep C spreads primarily through blood. You get it by coming into contact with blood from somebody infected with hepatitis C. So usually in humans, we see this through sexual transmission. We see this through used needles. We see this like in both the drug setting and in the healthcare setting. We see this. So again, if you're not having sex with the monkeys, then you're probably not going to get hepatitis C from a monkey, especially one of those that was in Mississippi. But yeah, if you get this, you can get like some of these weird symptoms, like dark colored pee and gray colored poop. That's because you're not producing the there's a particular compound that the liver produces to so if you produce bilirubin through if you have anemia where like your blood cells explode or etc., there are bilirubin compounds that are produced from lysis of blood cells, and that goes into the liver. The liver processes bilirubin and gets it out of the system, which is why you get jaundice when you have liver failure. So if you can't get rid of your bilirubin, you get jaundice, and you can't expel it into the two places where they normally go, which are the kidney and the GI tract. So you get gray colored poop because you're not excreting the bilirubin into the poop, and it ends up going more into the urine because there's a certain way that the body processes bilirubin and has to conjugate it, and the permeability of bilirubin across the certain membranes prevents it or allows it to be excreted in one way or another. So if you can't conjugate the bilirubin, you can't excrete it into the stool. The way that it has to go is through the kidney, and that has a smaller capacity to handle that. So you get buildup of bilirubin and therefore jaundice and a lot of these other issues. So yes, that's kind of what you can expect from hepatitis C if you happen to get it from one of these monkeys. You can also get portal hypertension, which can be a big issue as far as blood pressure and contributing further to liver failure. They do have the management and treatment here. So they're now using direct-acting antiviral medications for hepatitis C, and there's also this list of specific brand names for that. So there's our little primer on hepatitis C. I am going to get into some other kind of statements about this. PETA had some thoughts about this whole situation. And also, we can take a little tour online and look at the Tulane Primate Research Center. That might be a little bit of fun to have today. So here we go. Let's read one of PETA's responses. So PETA heard about this, and they, of course, were absolutely pissed. And as I have mixed feelings about using animals in research, and I have very mixed feelings about using primates in this kind of research as well. I tend to favor animal rights. I tend to oppose animal experimentation. There is definitely the question of ethics of how do we get this research done. And of course, if we're prioritizing a species, of course, we're prioritizing our own over a different one. But are there other ways that we could be studying these things? And that's, kind of up for debate right now. But so despite having that kind of perspective already, PETA does take a lot of this kind of too far and sometimes has unreasonable requests and unreasonable perspectives on this. So their kind of first statement from yesterday was, so this is from the PETA Senior Vice President, Kathy Guillermo, regarding the escape of rhesus macaques from an overturned truck that was transporting them from Tulane National Primate Research Center. 5 of the escaped monkeys were killed, likely shot, while 3 remained missing Wednesday. Terrified monkeys running for their lives into unprotected populated areas is exactly the spark that could ignite the next pandemic. Monkeys can carry transmissible diseases transmissible to humans, including tuberculosis, and Tulane National Primate Research Center, where these monkeys were trucked from, has had disease outbreaks of pathogens deadly to humans in its monkey colony. This is the risk the greedy monkey experimentation industry has chosen for the public so they can line their pockets while these sensitive monkeys crisscross American highways in unmarked trucks. It's also a tragedy for the monkeys, whose only moments of freedom before death were the result of a truck crash. The importation and use of monkeys in laboratory experiments is emptying the world's forests while putting Americans at great risk, and it must end now. So, of course, there's the side that, I would love for these animals to remain wild and not spend their lives in captivity. However, we already addressed the statements about the transmissible diseases, the fact that, sure, we have some monkeys that are out there causing some trouble. The difference is, apart from B virus, some of these other things, yes, they are terrible to have an outbreak of. They're terrible to expose to the public. However, we have now we have 3 monkeys on the loose, actually not found yet. The likelihood of somebody getting tuberculosis from one of these monkeys, apart from the emergency response teams kind of on the scene for this, or if somebody just randomly gets attacked by these monkeys, the likelihood of people getting tuberculosis from these monkeys is incredibly low. And especially the risk of this becoming a more widespread epidemic or pandemic, if you will, from these monkeys is incredibly, incredibly low. Like I mentioned, the most common places for outbreaks of tuberculosis are human places. Like, we already have tuberculosis outbreaks in homeless shelters, prisons, military barracks, hospitals, etc. You're much more likely to get tuberculosis from one of those institutions. So if we're going to put a lot of emphasis on stopping tuberculosis outbreaks, which we are doing our best to contain the infections that are known and encourage testing of people working in those areas. We could be doing more to prevent people from needing to be in those areas. Like, we could significantly reduce tuberculosis transmission by housing people, by having safer prison systems, for having kind of the preventative measures that we give to the healthcare industry, having those protections for unhoused populations and for prison populations. So that would be where my money would go into kind of preventing this. I don't necessarily see 3 monkeys causing a massive epidemic, especially like unless again people start trying to take the monkeys in and making the pets and breeding them and all that. But that's a whole separate issue right there. The illegal side of animal trade. I think that's kind of the big thing I wanted to say about that. Let's read PETA's other statement. Okay, so after all of that occurred, so this was released today. This says, please see the following statement from PETA Senior Science Advisor for Primate Campaigns. They say, PETA calls on authorities to demand full necropsies and veterinary records for the monkeys killed in the crash in Mississippi, and to make the results public so communities will know the truth about the risks of sending terrified animals to crisscross U.S. highways in secret shipments. Don't let anyone fool you. The escape of diseased monkeys caught up in the experimentation industry into unprotected and unpopulated areas is not isolated. It is a predictable accident. No. This was a pretty rare incident. Think about the transport of livestock. Sure, there is risk that like those animals could be getting out and causing disease outbreaks. Yeah, there's a risk every time farmers transport their animals, anytime zoos transport their animals. And of course, PETA is of the perspective that all of those are wrong, that they shouldn't. Of course, PETA believes that like zoos shouldn't be keeping animals captive and all that stuff. But they're taking the risk anytime an animal is transported. They're taking the risk of that animal possibly having some kind of disease that they didn't know about, and then that disease transmitting to humans. And yes, the monkeys have diseases that could be more easily transmitted to humans on the basis that, of genetic similarity. However, yeah, and Harder Gamer in the side chat saying beef is a big problem here in the UK with TB. Yeah, so just by not transporting monkeys does not remove that risk. And even like removing the monkey experimentation does not remove that risk of transmission. Also, there's if these monkeys were breaking out of like if monkeys were involved in truck crashes and escaping as frequently as PETA is kind of implying, this would not have been as big of a story as it was. Like, we would not be talking about this all much. Be like, oh yeah, no, that happened last Tuesday where monkeys got out. That would be kind of different. But this is a one-time incident. I don't foresee this. Like, yes, was this risk foreseen? Probably. Like, do they account for this? Probably. That's why, they gave the precautions to the truck driver and to the law enforcement. Hey, you should be wearing PPE when working with these animals. So, yeah. They go on to say monkeys recently scrambled to freedom in Pennsylvania. Okay, so I guess so there have been other truck crashes where monkeys have gotten out. But that they aren't that frequent. Like, if you take three incidents of this compared to, I don't even know how many times monkeys have been transported, but sure, you can say, oh yeah, these multiple incidents have happened. Hey, HR, welcome. Are we getting 28 days later or not? Probably not. I don't have a lot of concerns related to this other than kind of the animal rights issue. But yeah, so sure, they could say that there's been a plurality of like escapes from transport. Maybe the response then isn't necessarily that monkeys shouldn't be used for these purposes. Again, a whole separate conversation about ethics of like using monkeys for research, but that's a whole separate thing. Like, just saying that, oh, there have been truck crashes where monkeys have gotten out, therefore stop using them in experiments. Like, that logic does not connect, right? Like, the next logical step would be to say, how are they being transported? What were the situations involved in the car crash? Like, was it driver error? Was it the other driver error? Like, was it local law as far as truck driving law? Was it how they were contained inside the truck? Was it too easy for them to get out? Like, should they make more durable containers for them? I don't know. There are plenty of other ways to address this than make the connection that because there have been monkeys in truck crashes, that therefore that was a predictable outcome. And that is going to cause all these disease outbreaks. Was it monkey business? Yes. Yes, it was definitely monkey business. And we already had the statement from Tulane that, because we had some latecomers coming in here, but it's okay because you can go back and watch the rest of the stream. But Tulane already, like, they disclosed, like, hey, we did not give these monkeys any illnesses. So thinking about this, like, the big one that we're trying to prevent transmission of is B virus. That is often asymptomatic in the monkeys. That one they probably didn't know, but I would also guess that they would be testing monkeys for things, knowing that they have humans working with them. And the humans are, of course, wearing basically hazmat suits when working with these monkeys, but they did not intentionally give the monkeys any illnesses. At this point, they had sold the monkeys to another research institution, so that already is kind of a moot point. The issue is the diseases that may have been present in the monkeys that we can't confirm that they weren't. Like, we can't prove that they didn't have these necessarily because they're so prevalent within those communities. Yeah, and Sabrina, absolutely. PETA's language is really annoying. And yeah, so it's, as much as I want to be supportive of animal rights, the way that PETA approaches this discussion is just kind of ridiculous. And the reason why there's so much emphasis on disease transmission prevention is because we already have a lot of data about prevalence of these diseases within these macaque populations. and not because of them being intentionally infected yet. I mean, they could in future experiments, but it's just kind of silly to demand the veterinary records for the monkeys and publicly release them. Like, this is the same thing for if you're transporting cattle. Like, are we going to demand the same thing from anytime cows are transported or pigs are transported? Heaven forbid dogs are transported, because dogs can transmit diseases to humans. Cats can transmit diseases to humans. So every time a cat gets out of the house, do we need to get full veterinary records? And like, that would be actually like more useful, because more people are going to try to, like, if it's a dog or a cat, more people are probably going to try to help the animal and may accidentally get infected. So that's something to consider there. But just like, where's the end game for this? Like, what do they propose? Like, they're obviously proposing releasing the veterinary records, but to what end are they going with this? And again, the idea of the sheriff's office miscommunicating that the animals were in fact infected with herpes, hep C, and COVID, where I still hypothesize that the reality was that in the communication between Tulane University and the truck driver was that, hey, there is a potential risk of disease transmission, so please wear protective equipment. That is probably what was actually said. But the sheriff's office took that and said, these monkeys are infected. Well, actually, it wasn't the sheriff's office first. It was the truck driver took it as, these monkeys are infected. And then the sheriff's office also took it as, these monkeys are infected. So this is, again, that telephone game that is like, sure, I can see the concern. However, this is definitely overblown. The significance of this is definitely overblown. Oh yeah, because they think that it's going to spark the next pandemic. Yeah, and this is the part where I do agree with PETA. Like, it is a tragedy for the monkeys who cannot escape panic and fear even in their brief moments of freedom. Yeah, like, I think the treatment of these animals is not great. I'm not a fan of animal experimentation, but PETA just kind of goes a little too overboard again with their statement here. Yeah, obviously the first reports of everything are always correct. Yeah. Who's paying me to have a nuanced conversation? Nobody's paying me. Yeah, we haven't gotten any super chats. But if we get some super chats, then I can say that I was paid to have this nuanced conversation. I do also have, if we get super chats, I do have the immunity shots. These ones are the turmeric and pineapple ones. So I think there's still a lot of ginger in these though too. The ginger gets you. I get heartburn from these all the time. Yeah, Sabrina, you are correct. Zoonotic transmission is still quite rare, as you understand. Yeah, and definitely go back and watch the rest of the stream, because really the big concern was B virus. The other ones are concerns, yes, but it's more often that monkeys get diseases from humans and less likely the other way around. So for the people that joined the chat recently, especially if you're trying to avoid hepatitis from a monkey, or even the case of B virus, which is a herpes virus, don't have sex with the monkeys. Don't go to Mississippi just to have sex with a monkey on the side of the road, because that's kind of the big way that you'd get those infections. So just stay away. And if you are going to interact with monkeys, whether it be in a zoo environment or in a lab environment, like, put on PPE first. Don't go cuddle with the monkeys in the wild, and then you should be good. you're more likely to get. Yeah, you knew I was going to say that. Yeah. Yeah, and as far as, like I mentioned, with COVID and tuberculosis, we already have enough transmission among humans. You're much more likely to get those diseases from humans. 3 monkeys still on the loose in Mississippi are not going to be the result of, or not going to be the cause of a next huge wave of COVID. That would be humans. Humans would be doing that. So I did really quickly want to look at Tulane's primate lab just to see kind of where these monkeys came from. Because they do have a pretty interesting setup here. So the Tulane National Biomedical Research Center, they do animal research, primate research specifically. So they do have, and look at this. So they do have pretty big enclosures, it looks like. This person's dressed in pretty full PPE. So I guess they're not in like hazmat suits, but they're in like surgical level of PPE, like hospital level of PPE, which is appropriate. Like that's fine. And yeah, they use these animals for research for medical advances, so including polio, smallpox, diphtheria, cholera, and measles. So it sounds like a lot of those vaccines were tested on monkeys, and treatments for those were tested on monkeys. So this has been an essential industry for the development of treatment of many often fatal diseases. And looking at AIDS too, we have treatment of HIV that has come out of these primate labs. So kind of taking into account like a cost benefit analysis, like where do we put everything ethically? Like how do we look at these primate labs, and who do we prioritize, or do we have other options for testing these medications? And that's, that's a question that's up for debate. Sabrina asking, aren't there some states where that behavior is legal? Probably. And, I did say early in the stream when I mentioned don't have sex with the monkeys on the side of the road, that I am mentioning it anyway. Like I shouldn't have to mention that, but I'm mentioning it anyway because this incident happened in Mississippi. And I'm sorry, Mississippi, but your reputation for understanding of health concerns is kind of low. So so please, Mississippi, be responsible. Do not go have sex with the monkeys that are on your interstate. And so they have a whole thing about how animal research is humane. So there are very set standards of how they conduct this research. According to the Animal Welfare Act, etc., they have veterinarians that are taking care of these animals and all that. So, and they are pursuing alternatives. They're trying to reduce the amount of primates that they need for these experiments and trying to see what other options they have as well. So here we go. Regulatory compliance and accreditation. So this is a federally funded animal research institution and is regulated by the USDA. We'll see how much longer we trust the USDA in this country, but when this organization was credentialed, I would have trusted them at that time. As far as the USDA under this administration, that is another topic of conversation. It's also accredited under Animal Plant and Health Inspection Service. So, they are accredited. They do have a license. So going back to my earlier point that this isn't illegal monkey trade. This is not illegal animal trade. This is regulated. This is licensed. This is accredited. So that is something to take into consideration with this whole situation. But they do have divisions of this for comparative pathology, immunology, microbiology, and veterinary medicine. So lots of cool stuff happening here. And look, they have little summer programs if people want to go experiment on the monkeys. It's an undergraduate research program if you want to go experiment on the monkeys over summer. It looks like you get paid to do that. Not very much, but you get paid. So it's a little okay. So there you go. Interesting stuff. All right. Well, that's pretty much all I have for today. We will see more of this develop in the next few days. I think maybe we'll see the remaining monkeys, whether or not they have been destroyed or if they're still out there. So earlier on in the day, they said that there was only one monkey still left, but then a few hours ago they said no, there are actually 3 monkeys still left. We'll find out exactly how many monkeys are left. Unfortunately, it sounds like they are all going to be euthanized to prevent public health concerns and prevent, aggressive behavior towards humans. So pretty unfortunate situation with regard to the primates themselves. However, the whole issue has been blown out of proportion. The concerns regarding the transmissible diseases have been exaggerated and miscommunicated. So I just wanted to get all of that information out so that, people can engage with this topic. This has been it was just a really funny headline to hear yesterday. But yeah, well, I don't even know what timeline we're in anymore. This is absolutely wild. But thank you to everybody for joining us today. I do plan on actually going live on. Whoa. The fire alarm just went off. So I'm going to see you all later. I will probably go on Twitch later. But and I think it's off. Okay. No, okay. So I will be going on Twitch later to play some Power Wash Simulator, I think. And also, do not miss this weekend. We will be talking about chiropractors, and especially we're going to be reacting to chiropractors reading x-rays, and it's going to be fun. So join me for Medical Myths this weekend. And Sonia, welcome to the conversation. And all of you, go back and watch the full video. But thanks again. I will see you later on Twitch, hopefully, and see you next time.